Hi there, I'm Kristen, Doctor of Physical Therapy at Light Healing and Bodywork. This routine was created as a safe exercise program for all trimesters of pregnancy. However, it would also be beneficial for someone who has low back pain or SI joint pain or dysfunction, instability. So with any exercises while you're pregnant, please be mindful of the baby so we don't do any exercises that compress baby space. And if you are in your third trimester, I would suggest only laying on your back for short periods of time or just avoiding that altogether, modifying with side lying or seated. And then also if your knees have been kind of tender, sensitive, we'll be kneeling a little bit today, so have a folded blanket nearby so that you don't have to hurt your knees while we're doing this exercise. Okay, I think that's about it, so let's get on the mat and we'll get started. Okay, we're going to begin in a comfortable seated position, whether that is with legs crossed or feet together or sitting in a chair or on the couch. So we're going to do some alternate nostril breathing here. So let's take the right hand and then we'll bring the the pointer and the middle finger towards the palm. And then we'll use our thumb and our ring fingers for closing the nostrils alternately. So as we breathe in through the left nostril, we'll close the right nostril. And then we'll switch, closing the left nostril with the ring finger, and we'll breathe out the right nostril. Breathe in the right nostril here. Switch over, closing the right nostril, and breathe out the left. Breathe in the left nostril here. Switching, closing the left nostril, breathing out the right. Continue to do this, flowing with your own pace of breath. For a few moments here. This breathing exercise helps to reconnect the right and left hemispheres of the brain. Remember, we switch after the inhale. When that's pretty even, we're going to just bring our hands to the knees for a moment, paying attention to our posture, scooping the belly in and up to engage the abdominals and strengthen the spine, lifting up through the spine, up all the way to the crown of the head, reaching it up towards the ceiling as if there's a line up there tugging you up, up, up. And then we're going to make our way onto hands and knees. So, wrists are going to be underneath the shoulders, and knees are going to be underneath the hips. We're going to stack here. If your wrists have been bothering you or are feeling a little swollen through the fingers, you can make fists and have that be your stability underneath your shoulders. Okay. And then we're going to, toes can be also either tucked under or flat on the mat, doesn't really matter. If you do want a little extra stretch through the bottom of your feet, if you've had some plantar fasciitis, tucking the toes under will help give them a little stretch, especially if you kind of push your weight back into your feet a little bit. All depends on your symptoms. Okay, so we're going to inhale here, and we're going to stick the tailbone backwards towards the toes, and that's going to drop the belly down towards the floor. And then the shoulder blades are going to draw down the back as we lift the chest forward and bring the head to look forward. And then as we exhale, we're going to tuck that tailbone under so it points towards the floor. And then the low back is going to round, and then the upper back is going to round, and then we're going to let the neck relax down, hanging the head. Inhale, we're going to stick that tailbone backwards, rolling through the spine here, lengthening still, no collapsing. Integrity through the spine, all the joints, through the shoulders, pressing down through the fists or the hands. Tailbone is the first thing to move as we inhale, creating that arching through the low back. And the head is the last thing to move. And then we exhale, tailbone goes down, back goes up, abs are engaged here, neck relaxes. And then your choice, you can continue to flow with this and your breath, or you can kind of start to stretch in different ways. So maybe bringing right hip towards right shoulder when your back is in a neutral position. And then left shoulder and left hip come together. Really just finding a stretch that your body is needing at this point in your pregnancy or back pain. Can even get really funky and go in circles and stretch the low back in different ways. A lot of times that low back gets really tight during pregnancy, so bringing your seat towards your heels, keeping your hands anchored up here, and stretching through that mid to low back really feels nice. And then we can go in circles, making sure to go in both directions. Remember to continue to press through the hands, maybe even through the fingertips if you're able, keeping integrity through the shoulders and not collapsing into them. Neck stays long, speaking about not collapsing there. I caught myself. Lengthen the head away from the body. Find the stretch that feels really nice. Body carrying that extra weight right in the belly. Needs a little extra stretch sometimes. Alright, so next we're going to place the left hand in the middle of the mat, and we're going to come onto the left side here. So left hip is on the mat, left wrist is on the mat. We want there to be very little space between the arm and the rib cage. So I'm going to scooch up a little bit here, slight bend through the elbow, and then legs are going to go long. We're going to keep the feet, knees, hips, and wrist in line as if we were on a tightrope here. And then right hand can either be up on the leg for a balance challenge, or have your hand in front of you to help steady yourself. If you notice some pain through the wrist, try bending your elbow a little bit, or you can even come onto your forearm with your hand at the corner of the mat. And what we want to do here is allow a sinking, a relaxation of the left side body down towards the floor. And then we're going to lengthen the spine and let the left ear come over the left shoulder. We're going to tip the head over the left shoulder, but press down through that shoulder so we're not collapsed and smushing into the shoulder. Keep your chin tucked towards your throat. Whichever variation you choose. Noticing the different sensations here. And then we're going to roll onto our backs. Bend the knees. And then if you'd really like a challenge, we're going to lower down slowly, okay, with the arms reaching towards the feet. Tight abdominal, scoop the belly in and up, and we're going to slowly lower down. This might not be possible towards the end of pregnancy, and that's okay. Tuck the chin towards the throat. It's the last thing to come down. Tuck the shoulder blades under once you arrive here, and bring the heels as close to your buns as you can get them. Arms can stay on the ground alongside you, or you can bend your elbows and point your fingertips up towards the ceiling. And then as we exhale, we're going to tighten the abdominal muscles, keep the back in one piece here, one solid unit, as we lift the pelvis up towards the ceiling. Option here to hold for a few seconds, or to flow with the breath. So breathing in as you relax and breathing out as you do the work. We're pressing down through the feet here. Quads are strengthened. Maybe even like you're pushing your feet and your body away from each other. This can also be done in a seated position. You would just have your hands down beside you, and that would be what's pushing against your surface instead of your neck and head. If you do have your elbows bent, you'll want to be pressing the backs of the arms down into the floor. Okay, coming to a rest here, take a breath or two. And then we're gonna kind of reverse where we're at. So, depending on how you like to sit up, what's possible for you, where you're at in your pregnancy, you can either come to your side and push up into sitting, or if you're early on, you might still be able to use your abdominal muscles to scoop in and up, and then reverse what we did coming down. So pulling those hands towards the feet to glide yourself up. We're going to bring the hands behind us, however you got here, and point the fingers towards the toes. And then we're going to come up, lifting the pelvis. Wrists should be about underneath the shoulders. It's kind of hard to gauge in this position, but just do the best you can. And we're going to hold it here. Chin stays down towards the throat. Very good. Okay, now we're going to add a little challenge here, or you can stay if this is challenging enough. But if you're able, we're going to put all of our weight into the right foot, squeeze that right butt muscle really tight, and then lengthen that left heel away from the body. We want a slight bend through the knee still, and that can take a little bit of weight, but try not to put a whole lot on there. And then we're going to bring it back, and then the left foot's going to take it. So squeeze that left foot, straighten the right knee, and bring it back up. You might notice I'm shaking. That's because this is hard, and if you are too, that's okay. It's a good exercise to do if you're shaking. That means it's strengthening you in a way that you are not yet strong. But keep it up and you will be. Alternating these heel taps here. Trying to keep the pelvis up and level. Let's do one more. Good. And then we're going to bring the buns down and roll over onto the right side. Again, choosing here whether we do on the wrist with the arm close to the rib cage and the legs out long, or forearm to the floor and legs out long. We're going to come into that nice straight line as if we are on a tightrope. Slight bend through the elbow, keeping it tucked towards the rib cage. And then finding a balance here, or steadying yourself with your left hand. And then we drop that right ear over the right shoulder, whichever position we are in. We're lengthening the spine up and away so that we don't have a collapse through that upper body. I should say through the left side body. And we let the right side body just drape down. Doing great here. Hopefully feeling a little bit of work by now. All right, we're going to bend the knees and come back onto all fours. Once again, wrists stacked underneath the shoulders. Put my hair back again. Okay, wrists stacked underneath the shoulders or fists. And then we're going to take all of the weight on the lower body onto the right knee. Tuck the toes under here to get a little bit more stretch. And then we're going to lengthen the left foot out, toes tucked under and on the mat. And we're going to push with the arms, we're going to push the body weight back into that left heel so we get a bit of a stretch through the left calf. This is a really good one to do if you're having some issues with plantar fasciitis or the tightness underneath the bottom of the foot. Stretch and hold here. Keep the tummy tight and supporting the spine. Try to keep the back of the head lifted up towards the ceiling, keeping integrity through the spine. And if you feel a little release, or when you feel that little release, we're going to take that weight back over the wrists and the right knee. And then keeping the pelvis level, we're going to lift the left toes. Okay, tummy needs to stay tight here and engaged. Supporting the back, supporting the pelvis. Do the best you can to keep the pelvis level. And then we're going to turn the toes in, and we're going to turn the toes out. Left foot, toes go in, toes go out. So we're operating with that leg, whole straight leg is a single unit here. Rotating the foot from the hip, toes in, toes out. Trying to keep the level pelvis, trying to keep the abdominals engaged, trying to keep that heel lifted towards the ceiling, about in line with the buns. But if you can't, that's okay. And then we're going to bend the knee and bring the left foot underneath the left hip. Good job. All right, we're going to try that on the right now. So, putting all the weight through the hands and the left knee. We're going to lengthen the right leg back, toes on the mat, and then we're going to push the weight back into the heel. Stretching the right calf this time, keeping the belly engaged and the neck lengthened. Oh, this is the good spot for the blanket if you need a blanket under your knees too. One of them. Paying attention to the body when you feel that release through the tissues of the calf. Alright, and then we're going to release the pushing of the weight back into that right heel and redistribute the weight between the hands and the left knee. And then we're going to lift that right heel up towards the ceiling, tight tummy, pushing down through the shoulders and into the fingertips. Trying to keep that pelvis level. There's a lot going on at once. And then we're going to rotate the toes in and out. Again, moving the whole right leg as a unit from the hip. Makes the toes turn. We're not trying to move the ankle, but actually rotating the hip. Using some of those butt muscles, back muscles, stabilizers. Remembering to keep the pelvis level, pushing the back of the head up towards the ceiling. Abdominals engaged. My foot might be going all over the place, and you know, if yours is too, you're in good company. This is hard work for both of the hips. We're just doing the best we can. All right, we're going to bring the right knee back down and maybe walk the hands back for a moment here. Take some of the pressure off the wrists, pulling the shoulder blades up and then down the back. Let's bring our hands behind, actually. We'll press our knuckles down towards the floor. On an inhale, let's lift the chest. And on an exhale, we're going to bring the head and the shoulders down towards the mat. The buns lift up off of the heels. Forehead kisses the mat and then comes back up. Keep the abdominals engaged throughout this movement. Hands reach up towards the ceiling when your forehead is down. Tight tummy. Always returning to that straight spine. And then let's take a moment here, really maybe even scooching the knees backwards so that we have a really good stretch through the bottom of the feet. And we're going to release the arms, bring the hands towards the front of the mat, walk the knees back just a little bit, and you can bring them a little bit closer together. Then we're going to glide the shoulders over the wrists so that the hips become straight. Pull the shoulder blades down the back here and see if you can twist the elbows so that the elbow creases are shining forward. Lengthen the spine, pull the belly in and up. Three, 2, 1. Good job. All right, we're going to bring the buns back. Tuck the feet, tuck the toes under, and then keeping the elbows the way that they were, the elbow creases shining forward and the fingertips pressing into the mat. We're going to straighten the knees, lift the buns up towards the ceiling, and then we're going to walk our feet forward towards the front edge of the mat, coming up on the fingers as you need to. Making space for baby by having a little bit wider stance here. Exhaling, releasing down. Inhaling, we're going to reach the crown of the head forward and away, coming up into a half lift here. Knees can be bent as much as is needed for comfort, but a moderate to strong stretch would be good for the hamstrings for this exercise. Exhaling and releasing down. Inhaling, lifting halfway, and then exhaling down. Inhaling one more time. Hands come to the shins or the thighs. to lift halfway, and then exhaling all the way down. And then we're going to bring our arms out to the side and stand all the way up this time. Hands come together at our chest. Long spine here. Lifting the toes so that they're not gripping into the floor. Lifting the arches. Tightening the belly. Slight bend through the knees. Low ribs knit together here. Relax the shoulder blades. Lengthen the head and pull the head backwards as if you're making a double chin. Then we're going to drop the hands down, shift all the weight onto the right foot, and we're going to take a big step back with the left. See if you can do it without looking. Did you do it? All right. And then this is going to be a really big step, so if you didn't do it big enough, go ahead and fix that now. Okay, and then we would ideally have the right heel in line with the arch of the left foot. The left toes are pointed out about 30 degrees. So that opens the hips a little bit. That's good. Create some space there. Right knee stays bent over the right ankle. We're going to bring the right hand down, either to the floor or fingertips, or if you have a block, you can use that. Depends on how stretchy you are. Okay, and then we're going to open the chest up towards the left side of the mat. Bring the thumb towards the armpit, into the armpit, and then as we exhale, we're going to stretch that arm long. Tuck the chin towards the throat, and if you want a little challenge for your neck, turn the head with the chin tucked so that your nose points towards the armpit. Find your breath and keep it strong. Keep that as your focus. And then on the exhale, we're going to lower the left arm down. And we're going to walk the hands, straighten the right knee. We're going to walk the hands towards the middle of the mat. Turn the toes by pivoting on the heel. Take a moment here, make the feet line up. Inhale, lift halfway. And then as we exhale, we're going to fold it forward, making sure there's enough space for baby. Stretching the hamstrings in a different way. And then as we inhale, we're going to continue to pivot on the feet so that the left toes are pointing towards the back edge of the mat, and then pivot the right so that the right toes are turned about a 30-degree angle. And then if you need to realign your heel and your arch, you may do so with your hands down. And then we'll just bend here. Bend the right or the left knee so that it comes over the heel, and bring the left hand on the inside of the left foot or on the block if you have one. Now we're going to open the rib cage up so that we're facing, once again, the side of the yoga mat or exercise mat, whatever you have. And then we're going to bring the right thumb to the armpit, tuck the chin back, and stretch the right arm overhead. And if you're looking for that little challenge for your neck, turning the nose towards the armpit, the right armpit. Keep that left knee bent about 90 degrees. Lift the toes so that we're not gripping into the mat. See if you can press into the outer edge of the back foot. That helps to stabilize the SI joint. Pull the shoulder blade down the back if your hand starts to sag. Engage the abdominals. Last deep breath in, and then on the exhale we're going to rotate the torso so the right hand comes down. We're going to straighten the left knee so that we can start to pivot the feet towards the side of the mat, adjusting as necessary for symmetry. And then once again we're going to fold forward. Hands are there for stability. Enjoy the stretch. Enjoy this time that you have to just exercise and make your body healthy and get ready for that baby. Okay, we're going to bring the hands to the hips next. Squeeze the belly, squeeze the buns, and straight back. We're going to lift up into a full standing position, and then step the feet together in the middle of the mat. Good job. You're doing great. Okay. For a balance challenge, we're going to bring all the weight onto the left foot. The right heel can be against the left ankle with the toes on the floor, or we can bring the bottom of the right foot against the calf, or if you're feeling extra balanced today, we can bring the bottom of the right foot against the thigh, helping along with the hand if you need it, and also holding on to something if you need it, no problem. We'll scoop the belly in and up, pull the shoulder blades down the back, bring the head back, and then hands can be on hips, hands can be at your heart, or you can stretch your hands overhead for a full body stretch. Finding something to stare at really helps. Remembering to only have your foot in the places I recommended, never against the knee. You don't want to have that force against the knee. Lift the toes if you can and prevent yourself from gripping. Pelvis we want to have as open as possible, with the knee going out to the side. Squeezing the left glute to support the stance, keeping a level pelvis. And then when you've had enough, we're going to release down and switch sides. Walking it out if you need to. All right, so that's either heel, left heel on the right ankle with the left toes down, or bottom of the left foot on the right calf, or bottom of the left foot on the inside of the right thigh. And really we're kind of mushing them together, bringing active engagement of the muscles together to stabilize so that we can also keep a level pelvis. Belly scooped in and up, low ribs knit together. Hands however you feel like you need them. Depends on the challenge level you're at today. Lift the toes and then gently place them back down to prevent gripping. Try keeping your weight balanced in between the 3 points on the bottom of the foot, the heel, the ball of the big toe, and the ball of the baby toe. Kind of makes a little triangle. Lengthening the spine, lifting the head up towards the ceiling. we've had enough of that one. We're going to bring that left foot back down. And we're going to take the feet a little bit wider than the hips and turn the toes out a little. Inhaling, and then as we exhale, we're going to dive down forward. And then from here, we're going to bend the knees and we're going to bring our sits bones towards the floor into a really deep squat here. This is a nice stretch and exercise to help get the pelvic floor ready for delivery. Hand options here are touching the floor to stabilize your balance, or backs of the arms are against the inner thighs and hands together. Lengthen the spine. Once again, we're always thinking about that spine in our posture. Good work. And then we're going to bring the hands behind. Come onto the seat. Feet, bottom of the feet together, soles of the feet together. Letting the knees fall open. Bring the heels towards you. I like to insert a little foot massage on here for a little self-care as we continue to lengthen our spines up towards the ceiling and allow the knees to relax to the sides. Folded blankets on either side helps if we're really tight, but this is a really nice one to help open up the hips again for delivery. Massaging the feet here, squeezing the toes. I would say avoid the back of the ankle where the Achilles tendon is for those who are pregnant, which is the point of this video. Spine, you can stop the massage whenever you would like, or just keep it going because it feels good. If you're able, leaning the torso forward for a little extra stretch through those inner thighs. And then we're going to come all the way down onto our backs or into a seated position, or laying in your side if you're in your third trimester. Invitation here to lower down as we did before, reaching the arms towards the feet, and then slowly controlled, lowering all the way down, letting one vertebrae at a time touch the floor. And then legs sent out long. Tuck the shoulder blades under the back. This is a nice opportunity to connect in with baby, putting one hand on your baby and the other hand on your heart. Taking a few deep breaths to just think about 3 blessings in your life, 3 things for which you are grateful. Allowing that feeling that you get when you think about these things to fill you up. Maybe noticing any areas of your body that still need some work or that feel really good. Thinking about baby. Thank you for choosing this practice to help strengthen and stretch your body in just the right way to prepare yourself for your new life. The light and spirit in me honors and appreciates the light and spirit in you.
let peace be with you.